My name is Dr. Sanjib Kumar Pal from Bakuda. Today's topic GRDS with acute lungs injury. First one, what is the GRDS? GRDS is a common condition where the stomach acid frequently flow back into the esophageal food pipe and causing the irritation and the symptom like heartburn, chest pain, and irritation. Means swallowed the food come back into the mouth. When GRD is frequently or severe, it does not just impact to the esophagus but can extend its effect to the lungs as well as. So, particularly there is the evidence of GRDS can contribute to acute lungs injury and serious condition with possibility life-threatening condition. Acute lungs injury involve widespread inflammation and increase the permeability of in the lungs, which can cause the respiratory distress and reduce the oxygenation. While acute lungs injury is often is seen patient condition like pneumonia, sepsis, trauma, GRDS, all play into the causing the worsening of the lungs injury. Key mechanism here is the aspiration when acid from the stomach and flow back enter the airway. It irritation of the lung tissue and cause the inflammation and damage the lungs and injure the lungs in acute lungs injury. And research suggested the microorganism of the acid stomach contain the lungs can trigger inflammation. The lungs and are highly sensitive of the foreign substance. So acidity of gastric consent particularly harmful and one of the substance reach in the lungs and can activate the immune response and ultimately worsening of the inflammation over time. And inflammation can cause the damage the lungs alveoli and thinness such as the lungs essential oxygen decrease. So people in severe uncontrolled GRDS, particularly when the lungs injury, especially if they extend the chronic respiratory issue. So symptom of the all acute lungs injury and associated with GRDS may include the shortness of breath, cough, wheezing, and severe cause difficulty with breathing, require the medical intervention. So how to manage? So manage of the GRDS is essential prevention the aspiration related lungs injury, lifestyle change an important role such as avoiding the food trigger, eating some meals, not lie down after eating, and elevated head while sleeping. The measurement can reduce and frequently and severity acid reflux episode. Also, the medication like proton pump inhibitor can easily helpful to stomach and production damage of the risks of aspiration. So, severity cause of the GRDS persistence despite the traditional treatment and surgery can necessary if required is a quintuplication may be considered. Close the monitoring and treatment the GRDS and important to the patient with extending lungs condition, worsening symptom of the developed acute lungs injury. GRDS patient more problem digestive disorder. So potential impact lungs health partially related to the acute lungs injury and understanding the risks of the taking the steps and managing GRDS effectively. So patient can reduce likelihood like lung complication and improve the overall frequency of life. So if the lungs injury can happen when the severe cause GRDS, vomiting and others cause. Thank you.